For 21 days, I had my period, which, at that point, you're like, something's really wrong. And now, psychologically, when you have your cycle for that long, you're just not the same woman.
It was multiple symptoms, bleeding beyond control, pain beyond control. During the day, I had to wing it with 2 or 3 pads, plus an overnight, the super tampon, and literally have stood up out of my chair at my desk and had blood run down my legs.
Yeah. My flow is so heavy, I'm not only wearing Depends, but I'm also wearing 2 overnight pads because I'm now flowing through my clothes.
Magazine covers and catwalks may be what supermodel Beverly Johnson is famous for, but her new focus is to educate women on uterine fibroids. Symptoms include heavy bleeding, pain, and frequent need to urinate. But embarrassment or lack of awareness often leaves women waiting up to a year before seeing their doctor.
Women need to educate themselves. There's no need to suffer in silence as I did.
Hysterectomy is not an option. I know that most of the women in my family, that were my parents' generation, have had hysterectomies, and that's not an option for me. There's got to be a better way.
For women suffering with uterine fibroids, it's really important to know that they have options. In the past, a patient might go to their gynecologist suffering with the symptoms of uterine fibroids, namely heavy bleeding, pelvic pain, increased urinary frequency, and we're told either to have a hysterectomy if they were not interested in having children, or a myomectomy, surgically removing the fibroid tumors and sewing the uterus back together if they were interested in fertility. And those were the only options available. It's a very safe, very effective, less invasive procedure that will treat the symptoms from fibroids very effectively. A woman can avoid surgery altogether and keep her uterus.
And of course, having a meltdown that the doctor wants to take my uterus, I don't understand why I'm going through this. And one of the ladies that was in the group basically says, have you ever heard of UFE?
And I had my UFE in December of 2005. And I have not had any trouble since.
I'm not anemic anymore. I'm not eating ice anymore. I have a normal life. My cycles are normal.
I can't even believe that I have not one symptom, nothing. My period is about 2 days a month, and it's regularly scheduled, and it's just too good to be true.
I don't have relief. I am free, okay? And I'm gonna say that again, I am free.
So it's important now for me to tell my young daughter and to watch and to help her take control and keep control of her health, because UFE was a real solution. And when you get real solutions, I think your life is so much better.